As our recent 8-nation bracket tournament in the New York Times showed, and I've discussed that a lot, many people think the United States healthcare system has a lot of problems. So it seems reasonable to think of policy changes that make things better, not worse. Making it harder for immigrants to come here to practice medicine would fail that test. That's the topic of this week's Healthcare Triage. By any objective standard, the United States trains far too few physicians to care for all the patients who need them. We rank towards the bottom of developed nations with respect to medical graduates per population. When physicians graduate from medical school, they spend a number of years in a residency program. I did not enjoy mine. Although they have their degrees, we still require them to train further in the clinical environment to hone their skills. Residents are more than learners, though. They're doctors. They fill a vital role in caring for patients in many hospitals across the country. We don't have enough graduates even to fill residency slots. This means that we're reliant on physicians trained outside the country to fill the gap. A 2015 study found that almost a quarter of residents across all fields were foreign medical graduates, and more than a third of residents in subspecialist programs were. Leaving training aside, foreign medical graduates are also responsible for a considerable share of physicians practicing independently today. About a quarter of all doctors in the United States are foreign medical graduates. As in many other fields, foreign medical graduates work in many of the areas that other doctors find less appealing. More than 40% of the American primary care workforce is made up of people who trained in other countries and moved here. More than half of all the people who focus on caring for older people, or geriatricians, are foreign medical graduates as well. As if this weren't enough, foreign medical graduates are more likely to practice in geographic areas of the country where there are physician shortages, like non-urban areas. And they're more likely to treat Medicaid patients too. As a physician who graduated from a domestic medical school, I've often heard others disparaging doctors who went to medical school outside this country as if they were inferior. Those complaints are not supported by data. A study from Health Affairs in 2010 found that patients with congestive heart failure or myocardial infarction had lower mortality rates when treated by doctors who were foreign medical graduates. Another from earlier this year in the BMJ found that older patients who were treated by foreign medical graduates had lower mortality as well, even though they seemed to be sicker in general. In other words, foreign medical graduates take care of patients who appear to be more ill, but seem to achieve better outcomes. A recent study in Annals of Internal Medicine shows that these graduates are also responsible for a significant amount of teaching. Of the 80,000 or so academic physicians in this country, more than 18% were foreign medical graduates. More than 15% of full professors in medical schools in the US were educated elsewhere, most often in Asia, Western Europe, the Middle East, Latin America, and the Caribbean. Foreign medical graduates also do a lot of research. Although they are ineligible for some NIH funding, which is granted only to citizens of this country, they still manage through collaboration to be primary investigators on 12.5% of grants. They led more than 18% of clinical trials in the US and were responsible for about 18% of publications in the medical literature. I spoke to the lead author of the study, Drew Kuhler, who's a physician at New York Presbyterian Hospital and a researcher at Weill Cornell. He said, and I'm quoting, "Our findings suggest that by some metrics, these doctors account for almost 1/5 of academic scholarship in the United States. The diversity of American medicine and the conversations, ideas, and breakthroughs this diversity sparks may be one reason for our competitiveness as a global leader in biomedical research and innovation." The United States is not the only country that relies on doctors trained or educated in other countries. We're not even the country with the highest percentage of such physicians. According to data from the OECD, almost 58% of physicians practicing in Israel are foreign medical graduates. About 40% of doctors in New Zealand and Ireland were also trained outside those countries. Because of the sizes of those nations, even though the percentages of foreign medical graduates are higher there, the total numbers aren't as high as in the US though. In 2015, the OECD estimated that the United States had more than 213,000 foreign-trained doctors, and no other country comes close. Britain had about 48,000, Germany about 35,000, and Australia, France, and Canada had between 22 and 27,000. I've listened to people tell me stories of physicians who leave Canada, because they were dissatisfied about working in a single-payer healthcare system. That might have been true decades ago, but in the last 10 years, that number has dropped precipitously. The number of Canadians returning to their country to practice may actually be higher than the number leaving. And although many feared the coverage expansions from the Affordable Care Act might lead to an overwhelmed physician workforce, that didn't happen. That doesn't mean that America doesn't have a shortage of physician services, as we've discussed in previous episodes, especially when it comes to the care of the oldest, the poorest, and the most geographically isolated among us. Even though we know foreign medical graduates care for these patients disproportionately, we make it very difficult for many born and trained elsewhere to practice here. Some Americans need those doctors desperately. All the evidence seems to suggest that policies should be made to attract them, not deter them. Sometimes talking about drugs and sex education and health insurance aren't advertising friendly, and making those important videos could actually hurt our bottom line. Healthcare Triage is made possible in part, therefore, by our supporters at Patreon. The support we receive from our patrons at Patreon allows us to keep making those kinds of videos without worrying about ad revenue. So thanks to all of them, and particularly thanks to our Surgeon Admiral Sam and research associates Joe Sevitz and Joshua Crow. If you'd like to support the show, we'd really appreciate it. You can go to patreon.com/healthcaretriage. While we're asking you to do stuff, please consider subscribing to the show, consider buying some Healthcare Triage merch as the holidays come up at hctmerch.com, and I've got a book coming out November 7th, The Bad Food Bible, available anywhere you'd buy books, and I'd really appreciate your picking up a copy.